Another one, which is quite important also, is volume overload. We must remember when we put in blood or when we transfuse blood, we also transfuse an extra volume to the patient. In certain group of patient, for example, elderly people or patient with liver, heart and renal disease in which they cannot control their fluid volume in their body, transfusion can cause many complications. One of them is volume overload, and this can cause heart failure because the heart cannot compensate to the increased volume that occur after transfusion. The sign and symptom of this volume overload is they will have increased blood pressure, and also they have difficulty in breathing because the fluid has filled up their lung, and also heart failure. How do you want to prevent this from happening, especially for elderly patients or patients with all the liver, heart and renal disease? We usually slowly transfuse them with packed red cells if they need it. Okay, we don't transfuse them with whole blood. If they don't lose blood, we don't transfuse them with whole blood. We transfuse them with packed red cells, and then we do the transfusion very slowly and monitor the patient very closely. And in certain situations also, we give them diuretic therapy. Diuretic therapy is a drug given to a patient to get rid of their fluid overload. So this drug will make them pass urine very frequently to make sure they don't have volume overload. Okay, that are the some complications that I have discussed. If you want to know more about it or you want to know other complications, you can read it in the book or we can discuss it during classes. Before I finish this lecture, I just give you a few conclusions. The first one is transfusion is an useful procedure, and in many situations it can save lives. However, it is not without complications. So good and wise clinical judgment is crucial before making a decision to transfuse a patient. The health professionals involved in transfusion service, including nurses, need to understand the risk of transfusion, and their expertise in providing safe blood transfusion is very vital. And as nurses, you also need to be aware what are the complications that can occur after transfusion or during transfusion, and you need to be aware of the signs and symptoms of transfusion reaction because you are the one who are usually with the patient most of the time. I just want to end this with a saying: blood transfusion is like a marriage. It should not be entered upon lightly, blindly, or wantonly, and definitely should not be more often than it is necessary. Okay, thank you for listening, and we'll meet in the class later. Okay, bye.